Good evening. Am I audible and visible? Good evening. Hi, Nikki. Good evening, Nikki. If I'm audible and visible, can I get a thumbs up, please? Hi, MedPsycho. Thank you, Jesti. So this is a session on biochem quiz. This is basically a biochem quiz for FMG aspirants, and for this I've chosen previous year MCQs from FMG papers. Okay, so using these MCQs, we'll try to learn about relevant facts and concepts. Not just those MCQs, I'll be telling about relevant facts and concepts as well. Okay, so before we start the session, let me tell you a few facts about Unacademy's plans. So currently we have a Med Scholar test series which will provide you a chance to win up to 100% scholarship, and this exam is scheduled for 21st May, and this paper would include 200 MCQs involving all 19 subjects, and the time would be between 10 a.m. and 1:30 p.m. So irrespective of the level of preparation you are in, please attempt this test to know your national level rank. So this will help you understand where exactly you stand and what you need to do to move further. Okay. You have marked 15 by 16, and I am very happy, Arun Sharma. You made my day. Yeah, most of the MCQs we had already discussed in all these YouTube sessions as well as in Unacademy sessions. You're right, Arun Sharma. Okay, so that's about the Med Scholar test. Please do not fail to attempt this test. Okay. And for all FMG aspirants, we have a target FMG 2023 batch, and I would like to tell you that 100 plus learners have qualified already in the Jan 2023 FMG exam. And this will be a high yield revision batch for FMG aspirants, and the duration of this course will be 3 months, and this would cover around 200 plus hours. And all 19 educators will be discussing high yield MCQs, frequently asked volatile topics, PYQs. Okay, and this is currently available at the cost of just 5,250. And to get this at this price, you can use my code, which is C Shanmugapriya, because if you use this code, you will get an additional 5% off. Okay. So that's all about Unacademy's plans. Now let's start discussing these MCQs. This is an FMG Jan 2023 question. Try to answer this. Which of the following pathways only takes place in a cell cytoplasm? Quickly answer this because it's a quiz. I would wait for you to answer choice A, B, C and D. What is the right answer? The right answer here is glycolysis, right? So in cell cytoplasm, glycolysis happens because the only oxidation which is anaerobic. Now where do you think beta oxidation happens? Beta oxidation of fatty acids. The moment you hear the term oxidation, very good all of you, excellent. Good Gokul, Arun Sharma, Hardik, MedPsycho, Nikki, Pratishta, yes it is glycolysis. So where does beta oxidation happen? Most of the oxidation processes happen in mitochondria. So that brings another question. Do you think all fatty acids get oxidized in mitochondria, or do we have any exceptions? Good Pratishta. Do we have any exceptions? Very long chain fatty acids do not get oxidized in mitochondria. They get oxidized in peroxisomes. So again another question. This has been frequently asked. What are the functions of peroxisomes? Just now I told you in peroxisomes very long chain fatty acids get oxidized, and the same suborganal ether lipids also get synthesized. What do you mean by ether lipids? Plasmalogens. Do you all understand this? If they ask you plasmalogens get synthesized where, what should be your answer? Your answer should be peroxisomes. And peroxisome is also related to oxidizing branch chain fatty acid. How many of you have learnt about Refsum's disease? Yeah, tell me what is that you have learnt about Refsum's disease. Refsum's disease is caused by the defect of alpha oxidation of branch chain fatty acids, a peroxisomal disorder. And in the same peroxisome, glycine and taurine conjugation of bile acids also happens. So can you all repeat it along with me? What are the functions of peroxisomes? At the end of this session, all the students who are watching this session should have memorized at least 100 facts. Yeah, that's the aim of the session. So answer this along with me. Peroxisome is related to very long chain fatty acid oxidation, ether lipid synthesis, branch chain fatty acid oxidation, and conjugation of glycine and taurine to bile acids. Okay. Now citric acid cycle happens in, we all know citric acid cycle is the final oxidation process which happens in mitochondria. So all of you please understand glycolysis wherein glucose becomes pyruvate happens in cytoplasm. Then pyruvate enters into mitochondria. Within mitochondria, pyruvate gets converted to acetyl-CoA. Then acetyl-CoA enters into citric acid cycle, comes out as carbon dioxide. So citric acid cycle happens in mitochondria. Good, Nikki. How about urea cycle? Urea cycle is one pathway which happens in two suborganelles. The first two steps of urea cycle happen in mitochondria. The remaining steps happen in cytoplasm. Okay, so urea cycle happens partly in mitochondria and partly in cytoplasm. So can we fill up this tabular column? Yeah, I want all of you to keep your chat box active, please. So tell me, where does glycolysis happen? Glycolysis happens in cytoplasm. Pyruvate dehydrogenase complex. Where does it happen? Pyruvate dehydrogenase complex is present in mitochondria. Citric acid cycle happens in mitochondria. Glycogen metabolism. When I say glycogen metabolism, it involves both synthesis and glycogenolysis. And both these pathways happen in cytoplasm. Gluconeogenesis. Excellent, all of you. All of you are answering it right. Yes, Arun Sharma is partly right. So Arun Sharma says heme synthesis, urea cycle and glycogenolysis. So heme synthesis and urea cycle happen partly in cytoplasm, partly in mitochondria. Okay, not glycogenolysis. Yeah. So glycogen metabolism happens in cytoplasm. How about gluconeogenesis? In gluconeogenesis, the first step, pyruvate carboxylase, is present in mitochondria. The remaining steps happen in cytoplasm. And the last step, catalyzed by glucose 6-phosphatase, that happens in endoplasmic reticulum. So gluconeogenesis involves multiple suborganelles. What are the suborganelles? Mitochondria, cytoplasm, and the last step happens in endoplasmic reticulum. Okay. HMP shunt is a cytoplasmic pathway. How about fatty acid synthesis? All of you tell me the right answer. Fatty acids get synthesized in cytoplasm. And where do they get oxidized? Oxidation happens in mitochondria. Very long chain fatty acids get oxidized in peroxisomes. Okay, so fatty acid oxidation partly in mitochondria, partly in peroxisomes. Now, ketone body synthesis. What are ketone bodies? They are products of partial oxidation of fatty acids. Because fatty acid oxidation happens in mitochondria, ketone body synthesis also happens in mitochondria. Cholesterol synthesis. Where does it happen, all of you? Start answering these questions. Cholesterol synthesis. You know that cholesterol is a steroid. And steroid synthesis happens in smooth endoplasmic reticulum. All of you please remember this. Rough endoplasmic reticulum is related to protein synthesis. Smooth endoplasmic reticulum is related to steroid synthesis. So cholesterol synthesis partly happens in cytoplasm, partly happens in smooth endoplasmic reticulum. Bile acid synthesis. Bile acids are also steroids. So bile acids also get synthesized in smooth endoplasmic reticulum. What did I tell you about urea cycle? Yeah, what did I tell you about urea cycle and heme synthesis? Both happen partly in cytoplasm, partly in mitochondria. Okay, so that's about the suborganelles and the pathways. Is that clear? Okay, so please don't forget, fatty acid oxidation happens in mitochondria and in very long chain fatty acids get oxidized in peroxisomes. Okay. Now this is an FMGE Jan 2023 MCQ. Again a previous year MCQ. Which of the following is not a micronutrient? Which is not a micronutrient? Calcium is not a micronutrient because it's a macronutrient. So what is a micronutrient? What is a macronutrient? Micronutrient is something wherein the recommended daily allowance is less than 100. Yes, calcium is the right answer. So what is a microelement? Microelement or micronutrient is something wherein the requirement is less than 100 milligram per day. And this list will include obviously vitamins, right? Micronutrient will include vitamins, iron, okay, copper, zinc, molybdenum, okay, molybdenum, manganese. So what are the micronutrients that you should remember? The first micronutrient that you should all remember is vitamins. After vitamin, it is iron, and then we have copper, which is a micronutrient, zinc, okay, molybdenum and manganese. So what are macronutrients? If the requirement per day is more than 100 milligram, then you call them as macronutrients. What are the macronutrients? That will include calcium, magnesium, potassium and phosphorus. Okay, calcium, magnesium, potassium and phosphorus. Okay, so please remember this list is a PYQ. As far as FMG is concerned, they do not ask you fresh MCQs that many. Okay, so you should be very clear about previous year MCQs. This is the latest MCQ. This is again a Jan 2023 MCQ. Melanin is synthesized from which of the following amino acids? What is the right answer? Melanin is synthesized from tyrosine. By which enzyme? Tyrosinase. And that is why tyrosinase defect causes what? Very good Medpsycho, very good Nikki, very good Karthik. Yes. That is why tyrosinase defect causes albinism. Okay. So what are the specialized products that you get from tyrosine? Tyrosine is not only converted to melanin, it's also converted to neurotransmitters. What are the neurotransmitters? Dopamine. Tyrosine gives rise to dopamine, norepinephrine, epinephrine. And it also gives rise to the thyroid hormone, be it T3, T4, reverse T3, all these get synthesized from tyrosine. So what are the specialized products that you get from tyrosine? It is melanin, dopamine, norepinephrine, epinephrine and thyroid hormone. So what are the specialized products that you get from tryptophan? Very good Paramasivam. Very good Nikki. Yeah. So from tryptophan, what is that you get? Tryptophan becomes 5-hydroxytryptophan. That becomes 5-hydroxytryptamine, which is nothing but serotonin. So what is a precursor of serotonin? It is tryptophan. And tryptophan is also a precursor for niacin. That is why we always say 60 milligram of tryptophan. Please watch this session carefully because every minute here counts. Okay, I will be telling you hundreds of facts and concepts, and as and when I tell you the fact, please memorize it. Okay, I will not waste even a second of your time. Okay, so 60 milligram of tryptophan is equivalent to 1 milligram of niacin. So what are the substances that you get from tryptophan? One is serotonin, the other one is niacin. Okay, now what are the specialized products that you get from phenylalanine? Phenylalanine becomes tyrosine, and then tyrosine becomes melanin, and all these neurotransmitters and thyroid hormone. Okay, good Karthik, good Medpsycho. And this I must have seen 5 times in FMGE PYQ. Yeah, this is probably the most frequently asked image based question. So what is the image that is provided to you here? Do you see the image? Yeah, it is Castle's necklace. And Castle's necklace, very good Yashwant, very good Saurabh, Medpsycho, yes, Pellagra, excellent, yeah. So all of you please remember Castle's necklace represents what? It represents dermatitis, photosensitive dermatitis, which is a component of 3 Ds of Pellagra. What are the 3 Ds of Pellagra? Diarrhea, dermatitis and dementia. Okay, diarrhea, dermatitis, dementia represent the 3 Ds of pellagra, and we know pellagra is caused by the deficiency of niacin. So what is the right answer for this question? The right answer for this question is choice A. Very good. Yes. And had there been an image based question on vitamin A, what is the image based question that you can expect? Do you all remember that vitamin A deficiency causes Bitot spots? Yeah, what are Bitot spots? Bitot spots are keratin debris which accumulate in the conjunctiva. Do you see that here? Yeah, so small triangular grayish white patches which are seen in the conjunctiva. Very good, excellent Medpsycho, good Gokul, good Karthik, good Paramasivam. So this is Bitot spot which is caused by vitamin A deficiency. Watch the session in another 20 minutes. I will be telling you about the WHO grading of vitamin A deficiency, which has been frequently asked in FMG. Okay, so Bitot spot is caused by the deficiency of vitamin A. Now, how about riboflavin deficiency? Riboflavin deficiency presents with angular stomatitis, right? So had they given you an image like this wherein there is angular stomatitis, then what is it? It's because of riboflavin deficiency. And also remember, riboflavin deficiency, the first sign, the first sign of riboflavin deficiency is circumcorneal congestion. Do you see that here? Yeah, circumcorneal congestion is the first sign of riboflavin deficiency. Okay. This is a June 2022 MCQ, last year MCQ. A child presents with complaints of urine turning dark on standing. This is again a frequently asked MCQ, right? So presents with complaints of urine turning dark on standing. It is caused by the deficiency of what? Urine turning dark on standing is black urine disease. Very good, Vignesh. Yeah, very good, Vignesh Sankran. Good, Saurav. Good, Bashar. Yes, Gokul. So urine turning dark on standing is black urine disease, right? So what is black urine disease? It is alkaptonuria. Alkapton means black urine disease, which is caused by the deficiency of homogentisate oxidase. So what are the other facts that can be asked about alkaptonuria? If they ask you which is the first symptom of alkaptonuria, your answer should be urine turning dark on standing. If they ask you what is the first sign of alkaptonuria, your answer should be Osler's sign. Okay, what is it? It is Osler's sign, and Osler's sign is nothing but brown pigmentation of conjunctiva. Yeah, it is nothing but brown pigmentation of conjunctiva along the line of attachment of medial and lateral rectus. Okay, and you should also remember about ochronosis. What is ochronosis? Degenerative condition. It's a degenerative condition of cartilage caused by the accumulation of homogentisic acid. What happens when homogentisic acid accumulates? It undergoes oxidation to form benzoquinone acetate. And this benzoquinone acetate undergoes polymerization to form melanin-like fibrils. And accumulation of melanin-like fibril is the reason for degenerative changes that you see in cartilage. Okay, so that's all about alkaptonuria. Now let's discuss about the other choices. You know the right answer is choice D, but what is choice A? Branch chain keto acid dehydrogenase deficiency. This causes maple syrup urine disease. So all of you tell me, repeat it along with me. Maple syrup urine disease is caused by the deficiency of which enzyme? It is branch chain keto acid dehydrogenase enzyme of branch chain amino acid metabolism. Isovaleric-CoA dehydrogenase deficiency causes isovaleric acidemia. Okay. Glutathione synthetase deficiency causes 5-oxoprolinuria. So please memorize all these one-liners. So these one-liners can be asked directly as a one-liner, or it can be asked as a case-based MCQ. If they ask this as a case-based MCQ, they might give you that there is burnt sugar odor. Yeah, if you see a term or a phrase as burnt sugar odor of urine, then you should think of maple syrup urine disease. Isovaleric acidemia presents with sweaty feet odor. What is the odor that you see in isovaleric acidemia? It is sweaty feet odor caused by the deficiency of isovaleric-CoA dehydrogenase. Should I annotate points on rapid revision? Please annotate on rapid revision notes, Shobi. Do it there. Most of these I've discussed in rapid revision videos. Yeah, did you see must know MCQs medley? You can note it down there. Okay, so isovaleric acidemia or isovaleric-CoA dehydrogenase deficiency presents with sweaty feet odor. Glutathione synthetase deficiency causes 5-oxoprolinuria. Now, this is again a frequently asked topic, right? Yeah, so I've chosen only frequently asked topics. What is the right answer here? This is also June 2022 MCQ. Which of the following is a complex 4 inhibitor of electron transport chain? Very good. Good, Sandeep. Good, S. Good, Sesha. Med Psycho. Yes, the right answer is cyanide. Cyanide inhibits the electron transport between complex 4 and oxygen. Okay. So what are the inhibitors of complex 4? It is not only cyanide, it is also hydrogen sulfide and carbon monoxide. So please memorize this list. Hydrogen sulfide, cyanide, carbon monoxide, all these three inhibit electron transport between complex 4 and oxygen. Okay. And what about amobarbital? Amobarbital starts with which alphabet? Starts with A, and we know that A is the first alphabet, right? So amobarbital inhibits electron transport between complex 1 and Q. Okay, how will you remember this? Between complex 1 and Q, the first alphabet is A, it is amobarbital. And then TTFA starts with which alphabet? T, right? 2, yeah, T stands for 2. So TTFA inhibits electron transport between complex 2 and Q. Okay, TTFA inhibits electron transport between complex 2 and Q. 2,4-dinitrophenol is an uncoupler. Okay, that's an uncoupler. And if they ask you about oligomycin, what will be your answer? Oligomycin is not an uncoupler. Oligomycin inhibits FO component of ATP synthase complex. Okay, oligomycin inhibits FO component of ATP synthase complex. Okay, so have you memorized this list? Hydrogen sulfide, cyanide, carbon monoxide inhibit electron transport between complex 4 and oxygen. Amobarbital starts with A, it inhibits electron transport between 1 and Q. TTFA starts with T, T stands for 2. So it inhibits electron transport between complex 2 and Q. 2,4-dinitrophenol is an uncoupler. Oligomycin inhibits FO component of ATP synthase complex. Yes, that is complex 5. Very good, Sandeep. Now, again a Jan 2023 MCQ. Which of the following enzymes is found to be deficient in von Gierke's disease? So don't you all know that von Gierke's disease is type 1 glycogen storage disorder? Very good, yes. Very good, Nikki, MedPsycho, Vignesh, Brenda, excellent. So von Gierke's disease is type 1 glycogen storage disorder, which is caused by the defect of glucose 6 phosphatase. And can anybody tell me about glucose 6 phosphatase? It's an enzyme of which pathway? Glucose 6 phosphatase is an enzyme of both glycogenolysis and gluconeogenesis. And what are the two pathways that we have to maintain blood glucose in our body? It is glycogenolysis and gluconeogenesis. Your body does not have any other magic to maintain blood glucose. We just have two pathways to do it. One is glycogenolysis, the other one is gluconeogenesis. Both these pathways are dependent on glucose 6 phosphatase. In that case, when glucose 6 phosphatase is defective, both these pathways cannot maintain blood glucose. So what will it present us? It will present as hypoglycemia. Vishal Maurya, I see that you have answered it as HMP shunt. What are ionophores? I will tell you, Sesha. I'll tell you after this MCQ for sure. Okay. So glucose 6 phosphatase is not an enzyme of HMP shunt. The enzyme of HMP shunt is glucose 6 phosphate dehydrogenase. So please don't get confused between the two. Glucose 6 phosphate dehydrogenase is an enzyme of HMP shunt. When that enzyme is defective, when HMP shunt is defective, NADPH cannot be generated. So RBCs are susceptible to lysis following exposure to oxidative stress. So G6PD deficiency presents as what? Vishal Maurya, do you understand the difference? G6PD deficiency presents as hemolytic anemia following exposure to oxidative stress. Whereas glucose 6 phosphatase defect is type 1 glycogen storage disorder, which will present with hypoglycemia. Okay. Now, branching enzyme defect causes Anderson's disease. What does it cause? It causes Anderson's disease. How have I asked you to remember it? A should be followed by B, right? A stands for Anderson's disease, B stands for branching enzyme defect. Okay, so Anderson's disease is caused by the defect of branching enzyme. So when branching enzyme is defective, liver starts storing glycogen. Yeah, liver starts storing glycogen without any branch point. And branches will provide compactness to glycogen. Without compactness, glycogen will occupy a larger space. And that causes hepatomegaly and liver cirrhosis. So tell me, what does Anderson's disease present as? Anderson's disease presents as liver cirrhosis. Okay. Now, debranching enzyme defect causes Cory's disease. Okay, it causes Cory's disease. How do we remember it? C should be followed by D. So C stands for Cory's disease, which is caused by the defect of D-branching enzyme. And D-branching enzyme is an enzyme of glycogenolysis. And this glycogenolysis happens in liver and in muscle. When liver glycogenolysis is defective, that causes hypoglycemia. When muscle glycogenolysis is defective, that causes exercise intolerance. So Cory's disease, a D-branching enzyme defect, presents with both hypoglycemia and exercise intolerance. Okay. Now muscle phosphorylase defect, M for M, muscle phosphorylase defect causes McArdle's disease. What will McArdle's disease present with? When muscle enzyme is defective, that will present as exercise intolerance. So have you understood the outline of glycogen storage disorders? Yeah. So can we fill up this tabular column? I want you to help me to fill up this tabular column. After this, I will give you just an outline of what these disorders would present themselves as. Okay. So what is type 1 glycogen storage disorder? Type 1 is WAN. What is second wind phenomenon? Okay. So I am yet to answer about ionophores and about second wind phenomenon, both of which I'll do now. Okay. So after we finish filling this tabular column. Okay. So what is type 1? Type 1 is von Gierke's disease. Tell me which enzyme defect causes von Gierke's disease. It is glucose-6 phosphatase. What is type 2? Type 2 is Pompey's disease. Pompey's disease is caused by the defect of acid maltase or alpha glucosidase. Okay, Pompey's disease is caused by the defect of acid maltase or alpha glucosidase. Do you all remember that beta glucosidase defect causes Gaucher's disease? All of you? Beta glucosidase defect causes Gaucher's disease. Alpha glucosidase defect causes Pompey's disease, which is type 2 glycogen storage disorder. What is type 3? Which is the third alphabet? The third alphabet is C. So type 3 is C, which stands for Cory's disease. After C, it is D. Cory's disease is caused by the defect of D-branching enzyme. Okay. Now, what is type 4? You are done with C and D. So, 4 is A and B. So, type 4 is Anderson's disease. And I told you Anderson's disease is caused by the defect of branching enzyme. This is the one which I told you will present as hepatomegaly and liver cirrhosis. And then type 5. Okay. Reverse type 5. 5 is Roman letter 5. You reverse it and write it twice. So what is it? M. Type 5 is McArdle's disease. M stands for M. McArdle's disease is caused by the defect of muscle phosphorylase. Okay, muscle phosphorylase. And then type 6 is Hirsch's disease. H for H. Hepatic phosphorylase defect. Hirsch's disease is caused by the defect of hepatic phosphorylase. Type 7 is Tarrow's disease. So tell me, what is the cause of Tarrow's disease? It is caused by the defect of phosphofructokinase 1, the rate limiting enzyme of glycolysis. Are you clear about this? Yeah. So type 1 is von Gierke's glucose-6 phosphatase defect. What did I tell you it will present as? Glucose-6 phosphatase defect will present as hypoglycemia. Pompey's disease or acid maltase or alpha glucosidase defect will present as, which is the pump of your body, all of you? Which is the major pump of your body? Heart. Right? So Pompey's disease presents with heart defect, which is cardiomegaly. It presents as cardiomegaly, cardiomyopathy. Okay? Cory's disease, D-branching enzyme defects, a glycogenolysis defect of both liver and muscle. So, liver glycogenolysis defect will cause hypoglycemia. Muscle glycogenolysis defect will cause exercise intolerance. Okay. And what did I tell you about Anderson's disease or branching enzyme defect? A larger glycogen which is not compact will accumulate in liver. That causes hepatomegaly and liver cirrhosis. So, Anderson's disease does not present with hypoglycemia or with exercise intolerance. Anderson's disease will present as hepatomegaly and liver cirrhosis. McArdle's or muscle phosphorylase defect will present as what? Exercise intolerance. So this is where you will have to know about second wind phenomenon. One second, let me find an empty space. All right. So somebody asked me about Sesha, right? Sesha asked me about second wind phenomenon. So second wind phenomenon is a feature of McArdle's disease. Okay, so in McArdle's disease, the enzyme that is defective is muscle phosphorylase. When muscle glycogenolysis is defective, muscle will not get the necessary glucose 6-phosphate for anaerobic glycolysis. When there is no anaerobic glycolysis, ATP will not be produced. When ATP is not produced, the person will not be able to exercise. That is why I said they will present with intolerance. What will they present as? Intolerance to anaerobic exercises. Why only to anaerobic exercises? Because if you ask the person to perform aerobic exercise, the person will be able to do it happily, because aerobic exercise will use fatty acid as the fuel. Only when it is anaerobic metabolism, the person becomes dependent on glucose 6-phosphate. That is when they present with intolerance. So all of you remember, McArdle's disease will present as what? McArdle's disease will present as exercise intolerance, intolerance to anaerobic exercises, wherein the person will complain of painful muscle cramp following an isometric exercise or anaerobic exercise. Now, what is second wind phenomenon? Even after the person complains of painful muscle cramp as and when the person is performing anaerobic exercise, if you ask the person to continue exercising, after 10 to 15 minutes, the person says that my pain is getting relieved of. So what is the reason for pain relief after 10 to 15 minutes of exercise? It is because there is a local vasodilatation that happens quickly. And because of this vasodilatation, muscle will switch over from anaerobic metabolism to aerobic metabolism. Once it starts using aerobic metabolism, it starts using fatty acid oxidation. That is normal. And that is called a second wind phenomenon. Do you understand that, Sesha? So, second wind phenomenon is a feature of McArdle's disease, where the person will initially complain of painful muscle cramp after asking the person to perform anaerobic exercise. And after some time, there will be a pain relief, that is because of switch over from anaerobic metabolism to aerobic metabolism. Okay. And then somebody else asked me about ionophores, right? So what are ionophores? Ionophores are ion channels which get inserted into the inner mitochondrial membrane. Okay, so I hope you all know about electron transport chain. So in electron transport chain, what happens is hydrogen ions, in electron transport chain mediated oxidative phosphorylation, hydrogen ions go through FO component of ATP synthase complex, and this hydrogen ion movement through FO component is responsible for ATP generation. Okay, now what are ionophores? Ionophores are ion channels, and these ion channels get inserted into the inner mitochondrial membrane. And through these ionophores or ion channels, hydrogen ions will bypass. And because hydrogen ions do not go through FO component, ATP will not be generated. But even here, hydrogen ions move from a region of higher concentration to a region of lower concentration. So energy will be liberated out as heat. Okay, energy will be liberated out as heat. It is not coupled. Energy liberation is not coupled to phosphorylation. That is why we call all ionophores as uncouplers. So what are the facts that you need to know about ionophores? Ionophores are all uncouplers. What are uncouplers? Uncouplers uncouple oxidation from phosphorylation. In the sense, oxidation of fuel happens continuously. Energy is getting liberated continuously, but the energy is not used for phosphorylation. So the energy will be liberated out as heat. Now, how was this brought about? It is because all ionophores are ion channels which get inserted into the inner mitochondrial membrane. Through these ionophores or ion channels, hydrogen ions bypass. Because hydrogen ions do not go through FO component, ATP is not generated. So energy gets liberated out as heat. Okay. So what are the effects of what are the effects of ionophores? Ionophores have three effects. One is no ATP production. The first effect is no ATP production. Second effect is increased heat production. third effect is when there is no ATP production, for want of ATP, more and more fuels get oxidized. So there will be an increase in the rate of oxidation of all the fuels. Okay. So who asked me about ionophore? Sesha again. Sesha, is it clear? Okay. Answer this. Which of the following plays a role in collagen maturation? Again, FMGE Jan 2023 MCQ. There are two substances which are necessary for collagen maturation. This keeps repeatedly asked. Okay, this is getting repeatedly asked. So one is copper, the other one is ascorbic acid. Gokul, it is not copper and zinc. The answer is, as MedPsycho has answered it, the answer is copper and zinc. This is a Jan 2023 MCQ. I hope all FMG aspirants have started working on previous year questions. Okay. So I always say this, if you do not answer a question which is newly propped up in that year paper, your rank does not get affected. Okay, so don't go behind rarely asked topics. Okay, but if you're not able to answer a repeat question, then your rank, of course, you're not worried about the rank, it's all about clearance. So as far as FMG is concerned, it's all about repetition. Most of the topics get repeatedly asked. So please ensure that you have worked out at least last 4-year papers of FMG. When I say last 4-year papers, 8 question papers. So the last 8 question papers, you should be very thorough. Okay. So which of the following plays a role in collagen maturation? It is both copper and ascorbic acid. Why? Because ascorbic acid or vitamin C, okay, ascorbic acid or vitamin C is necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase, both of which are necessary for converting proline and lysine to hydroxyproline and hydroxylysin. And then how about copper? Copper is necessary as a coenzyme for lysyl oxidase. And lysyl oxidase is necessary for collagen cross-linkage formation. So remember, collagen starts with C. What are the 2 micronutrients that you need for collagen maturation? Both start with C. So what are they? Vitamin C and copper. Why do you need vitamin C? It's necessary as a coenzyme for prolyl hydroxylase and lysyl hydroxylase. Copper is necessary for lysyl oxidase. Okay. So this is a tricky question and this was asked in FMG June 2022. Deficiency causing tingling sensation. The moment you see the term tingling sensation, you will search for B12, right? Because vitamin B12 deficiency causes peripheral neuropathy. It presents with pins and needles sensation in the glove and sock distribution, right? So you'll search for B12, but you don't see B12 at all here. In which case, what can you choose? Yes, Brinda is right. In which case, you can choose thiamine. Okay, because thiamine deficiency causes dry beriberi. Don't we know that? Yeah, thiamine deficiency causes dry beriberi, which is CNS involvement. So it can present with peripheral neuropathy to start with. Of course, it progresses to encephalopathy. But initially it starts with neuropathy. So the best answer for vitamin deficiency causing tingling sensation would be B12 deficiency. If you don't see B12 deficiency, go for thiamine deficiency because it causes dry beriberi with CNS involvement. Okay. Which immunoglobulin is present in serum or plasma at the highest concentration? What is the right answer? Which is present in serum or plasma at the highest concentration? It is IgG. Answer is choice A. It's a Jan 2023 MCQ. It is IgG. So what are the other facts that you need to know about immunoglobulins as one-liners? The first one is maximum concentration. The second one is, yes, very good. Excellent Sesha, excellent Mohammed, Brinda. Yes, so the other facts that you need to know about IgG is it's responsible for secondary immune response. Please remember, primary immune response is mediated by IgM, secondary immune response is by IgG. And the next fact about IgG is it can cross placenta. So in the fetus or in the neonate, if you see IgG against any infection, it means it's fetally transmitted IgG. It means the fetus is not infected, the mother is infected, and the mother's IgG has been transmitted across placenta to the fetus. Okay, so that's about IgG. Now about IgA, it is responsible for surface immunity. Okay, and IgM, please remember IgM is a pentamer. What do I mean by pentamer? In IgM you see 5 copies of 2 heavy chains and 2 light chains. Okay, so IgM is a pentamer. So if they ask you which of the following immunoglobulins has got the largest structure, has got the highest molecular weight, in either case your answer should be IgM. And because of its larger size, can it cross placenta? Because it's a pentamer, it cannot cross placenta. And it is responsible for primary immune response. So if you see a child, if you see a fetus, then you see IgM against any of the infections, it means fetus has been infected. Do you all understand this? Yes. Hyper IgM syndrome. Yeah, I will tell you about this. It's principally because have you heard of isotype switching? Biscott-Aldrich syndrome is because of hyper IgM, and this is because of a lack of isotype switching. So the first class of antibody that is usually produced against any infection would be IgM, and then slowly there should be isotype switching wherein IgM should become IgG or it should become IgA depending upon what kind of an infection it is. But when there is isotype switching defect, all the antibodies that get generated will be of IgM type. So it is related to hyper IgM syndrome. Okay. So what was I telling you? That's about IgM, and IgE is related to hypersensitivity and allergic reactions. Okay. So answer this please. Nitric oxide is formed from which amino acid? What is the right answer? Nitric oxide is formed from arginine. Okay. So I want you to know that when arginine is acted upon by endothelial nitric oxide synthase or inducible nitric oxide synthase, it gets converted to nitric oxide. And from arginine, you don't only get nitric oxide, you also get COPS. From arginine, you don't only get nitric oxide, you also get COPS. What does COPS stand for? C stands for creatine. Okay, C stands for creatine, and this has been frequently asked in FMGE. They have always asked you what are the amino acids that are necessary for creatine synthesis. You can remember it using a mnemonic game. Yeah, what does game stand for? Glycine. For creatine synthesis, you need glycine, you need arginine, and you need methionine. So tell me, what are the 3 amino acids necessary for creatine synthesis? Remember the mnemonic game: glycine, arginine, and methionine. So from arginine, you don't only get nitric oxide, you also get creatine. And then you get O. What is O? Yeah, so have you heard of putrescine, spermidine? Yeah, so you have creatine, ornithine, putrescine, spermidine. So all these are products or specialized products that you get from arginine. And from tryptophan, what do you get? This I've already told you, right? From tryptophan, you get 5-hydroxytryptophan, 5-hydroxytryptamine, which is serotonin. And not only serotonin, you also get niacin. Okay, serotonin and niacin. So this is an interesting image-based question which was asked in FMGE Jan 2023. Okay, so tell me the right answer. Very good, Sesha. A patient presented to the OPD with liver damage. The picture depicts a patient having, one second. So the picture depicts a patient having their eyes examined. Which of the following factors is the cause of this condition? So can you describe? Very good, Mohammed, yes. So can you describe what is shown in the image? What is shown in the image is a sunflower cataract. Okay, sunflower cataract is a feature of Wilson's disease. And what is Wilson's disease? It is copper toxicity, right? Wilson's disease is caused by copper toxicity. So answer for this question is copper. Okay, but let me tell you about other cataracts as well, which can be asked as image based question. Have you heard of snowflake cataract? Yeah, Wilson's disease. You're right, med psycho. So have you heard of snowflake cataract. Snowflake cataract is caused by juvenile diabetes. So in juvenile diabetes, when there is hyperglycemia, excess glucose gets into lens fibers. And within lens, aldose reductase will act on glucose, will convert it into sorbitol. And this sorbitol causes cataractous changes that causes snowflake cataract. Very good. Yes. So which enzyme is responsible for diabetic cataract? It is aldose reductase. Which alcohol is responsible for diabetic cataract? It is sorbitol. Okay. And then have you heard of oil drop cataract? The next one is oil drop cataract, which is a feature of galactosemia. So these are the image based questions that can be asked as far as cataract is concerned. Okay. So sunflower cataract is Wilson's disease, which is copper toxicity. Snowflake cataract is juvenile diabetes caused by sorbitol. And then oil drop cataract is caused by galactosemia, caused by galactitol or dulcitol. Very good, Campylobacter. Good. A very simple question. Yeah, it's also a Jan 2023 MCQ. Breastfeeding is contraindicated in which of the following conditions? Obviously in galactosemia. Why should it be contraindicated? Why should breastfeeding be contraindicated in galactosemia? There is galactose metabolism disorder. Breastfeeding, breast milk has got lactose. Lactose gets digested to give galactose and glucose. And if there is a galactose metabolism disorder, it's going to affect the child. That is why breastfeeding is contraindicated in galactosemia. Okay. So this is a case-based MCQ which was asked again in Jan 2023. A patient who was in excruciating pain all over his body was taken to the hospital. In recent years, he has experienced these incidents frequently. When exercising vigorously, the ache begins. Anemia was detected by blood examination along with elongated red blood cells as opposed to concave ones. So tell me, what does the history tell you about sickling crisis? The history is about sickling crisis. And what is the defect? What is a molecular defect which causes sickle cell anemia? Many of you are answering it right. Good. Very good, Brinda. Very good, Anjum, Sesha, MedPsycho. Yes. So the answer is in sickle cell anemia, there is a mutation because of which a polar amino acid glutamic acid is replaced by a non-polar amino acid valine at the 6th position. Okay, so please remember, in sickle cell anemia, a polar amino acid glutamic acid. Why am I calling glutamic acid as polar? Anything which is an acid is negatively charged. Anything which is charged is polar. So this polar amino acid glutamic acid is replaced by a non-polar amino acid valine in the 6th position. Okay, so let me tell you the basis of sickle cell anemia here. The 6th amino acid comes to the surface, even in you and me, in all of us who have a normal adult hemoglobin also. The 6th amino acid comes to the surface following deoxygenation of RBCs or dehydration of RBCs. Okay, following deoxygenation of hemoglobin or following dehydration of RBCs, 6th amino acid comes to the surface in globin chain. When it comes to the surface, if it's a normal glutamic acid, does not cause any abnormality. But because of a mutation, if this glutamic acid is replaced by valine, okay, valine is a non-polar amino acid, and this non-polar amino acid creates a hydrophobic interaction with anything which is non-polar nearby. What is a non-polar structure that is nearby? It is the RBC membrane. So this creates a sticky patch because of which globin chains go and stick to RBC membrane. And all globin chains go and get deposited along the RBC membranes, and this makes the RBC membrane less deformable. So when RBCs try to go through splenic sinusoids, because they are no more deformable, the membrane will get pinched off, and that causes sickling crisis. So when does sickling crisis happen? Only after deoxygenation or only after dehydration. And that is why the history, yeah, the pain starts when exercising vigorously. Do you understand this? So this is sickling crisis, and that is why the person is not supposed to exercise. The person should not get deoxygenated. The person should not get dehydrated if you make a diagnosis of sickle cell anemia. because only after that the 6th amino acid comes to the surface, sticks to the RBC membrane, causes sickling crisis. Okay, so what is the right answer here? The polar amino acid glutamic acid is replaced by a non-polar amino acid, which is valid. A patient presented to the OPD, this is also a Jan 2023 MCQ. A patient presented to the OPD and complains of diarrhea. The patient was later diagnosed with dementia and photosensitive dermatitis in sun-exposed areas. Can you explain the history, please? Yeah, if you consolidate the history, what is that you observe? Diarrhea, dermatitis and dementia, right? Diarrhea, dermatitis and dementia, which is 3 Ds of pellagra. So which vitamin deficiency is responsible for this condition? It is niacin. Okay, that is why pellagra is a frequently asked topic in FMGE. Okay. A woman with complaints of pain, tingling sensation and numbness of the foot has a history of taking vitamin supplements. Hi Hippo, meeting you after a long time. Which of the following is responsible for this patient's condition? So they are asking you which hypervitaminosis will cause tingling sensation. Yeah, this dermatitis component is Castle's necklace. You're right, MedPsycho. So which hypervitaminosis will cause tingling sensation, pain and numbness? It is definitely not increased vitamin B12. I said deficiency of vitamin B12 will cause tingling sensation. So hypervitaminosis B6. Okay, beriberi is not a toxicity, beriberi is a deficiency. How about vitamin A toxicity, all of you? In FMG, I've seen MCQs on vitamin A toxicity also. Please remember, vitamin A is a fat-soluble vitamin which is stored in liver. So anyone who consumes excess quantity of liver, okay, anybody who consumes excess quantity of liver can present with vitamin A toxicity, and that presents as pseudotumor cerebri. What do you mean by pseudotumor cerebri? The person will present with all features which resemble a space occupying lesion in the brain, but there is no space occupying lesion. So what will the presentation be? The person will present with irritability, headache, vomiting. Increase in intracranial tension will cause hypertension and bradycardia. Okay, there will be bony exhaustosis. So looking at all these, you might think of a space occupying lesion, but imaging studies will not reveal any space occupying lesion. That's why it's called a pseudotumor cerebri. That is about vitamin A toxicity. So vitamin A toxicity is not going to present with pain or tingling sensation. So what is the right answer? The right answer is hypervitaminosis B6. Okay, so if the B6 supplementation is beyond 1000, if the B6 supplementation is beyond 1000 milligram per day, it causes hypervitaminosis B6, though it is a water soluble vitamin, and that is found to present with tingling sensation and pain. Okay. Vitamin A deficiency leads to what? Xerophthalmia, beriberi, pellagra, neuropathy. A very simple MCQ, right? Vitamin A deficiency leads to xerophthalmia. So beriberi is caused by which deficiency? Thiamine deficiency. Pellagra is caused by niacin deficiency. Neuropathy can be caused by B12 or thiamine deficiency. Okay, so what is the right answer? The right answer here is xerophthalmia. Okay, so now I am going to tell you about the WHO grading of vitamin A deficiency. So we know WHO grading of vitamin A deficiency includes starting from XN, and then you have X1A, X1B, X2, X3A, X3B, and then you have XS, right? XS and XF. So this is about the WHO grading of vitamin A deficiency. So let's start with what is XN. N stands for nyctalopia. Yeah, N stands for nyctalopia. So tell me, what is the first sign of vitamin A deficiency? It is nyctalopia or night blindness. And then X1A is conjunctival xerosis. Okay, this is conjunctival xerosis. And what is X1B? B stands for Bitot spots. Yeah, B stands for Bitot spots. X2 is corneal xerosis. Yeah, X1A is conjunctival xerosis, X2 is corneal xerosis. What is X3A? It is corneal ulcer. Yeah, corneal ulcer involving less than 1/3 of the cornea. X3B is corneal ulcer involving more than 1/3 of the cornea. XS is corneal scar. XF is xerophthalmic fundus. Okay, so have a look at this. This is what I just told you. XN stands for what? Nyctalopia. X1A is conjunctival xerosis. X1B is bite dot spots. X2 is corneal xerosis. X3A is keratomalacia or corneal ulcer involving less than 1/3 of the cornea. X3B is more than 1/3 of the cornea. XS is corneal scar and XF is xerophthalmic fundus. Okay, so that's about vitamin A deficiency causing xerophthalmia. And before I finish this session, I would like to tell you about the various forms of vitamin A. So tell me, what are the various forms of vitamin A? We have the alcohol form retinol. We have the aldehyde form retinal. We have the acid form, which is retinoic acid. Now, what is the significance of the alcohol form retinol? That is a form in which vitamin A is absorbed, transported and stored. So, this was asked once in FMG. The form in which vitamin A is stored in liver is retinol, the alcohol form. Retinal. In retinal, do you see retina? Yeah, you see retina. So, that's a clue that is given to you. This is the form that is present in eye. When I say eye, it is present in rods and cones, in rhodopsin and conopsin. So what is rhodopsin? Until stimulated by light, rhodopsin is levensis retinal in the center. Okay, until stimulated by light, rhodopsin is levensis retinal in the center, that is surrounded by opsin. Okay, now what is retinoic acid? We have all trans retinoic acid and 13 cis retinoic acid. All trans retinoic acid helps in growth and differentiation of epithelium. Whereas 13 cis retinoic acid suppresses keratinization of epithelium. Okay, 13 cis retinoic acid suppresses keratinization of epithelium. That is why what happens in vitamin A deficiency, when there is no 13 cis retinoic acid, there is excessive keratinization of epithelium, and that is why it causes phrenoderma. So another image-based question that can be asked in vitamin A is phrenoderma, wherein they show you a child showing the elbow. And in the elbow, you will see small papular lesions with keratin plug in the tip. Yeah, with keratin plug in the tip. What is it? That is phrenoderma. Yes, that is also used to treat acne. So phrenoderma is nothing but follicular hyperkeratosis, and this is caused by 13 cis retinoic acid deficiency. And excess keratinization is the reason for conjunctival xerosis X1A. That is the reason for corneal xerosis X2. And that is also the reason for bite dot spots, which is keratin debris accumulation. So all these are because of deficiency of 13 cis retinoic acid. Is that clear? Yeah, so that's about biochemical basis of xerophthalmia. So what is answer? Vitamin A deficiency causes choice A. So the remaining we will discuss tomorrow. So even tomorrow we have a live YouTube session at 9 o'clock, and I will come back to you with another set of previous year MCQs which will be asked as a quiz. Okay. So I hope this session helped. If you have any doubts, you can post that and I'll be able to support you. Okay. Thank you. Good night.